Are you pregnant? How exciting! But also don't know where to go next? Then maybe this is something that you should watch. Remember, pregnancy is meant to be pleasant, but there can be some complications that may occur during the course of pregnancy. If you're unsure, always seek advice from your own healthcare professional or visit us at athenawomensclinic.com.au. I'm Dr. Kavipriya Soma, a GP with special interest in women's health. So today we will talk about something very simple, but it's bothersome for quite a few pregnant women. So the complications that may happen in early pregnancy. So let's just say you're pregnant, say 4 or 5 weeks, it's when it gets confirmed. Yes, definitely see your healthcare professional. But please believe in yourself as well and trust that the process is all going to lead to healthy outcomes. Remember, pregnancy is physiological. Pregnancy happened way before doctors were here or any other health professionals. So let's try and keep it as physiological as possible, but also understand that there is help available if problems arise during pregnancy. 99% of the times we expect that the pregnancy will go without any complications and result in a beautiful baby. Unfortunately, some women or some pregnancies may be complicated by some complications, especially in the early pregnancy, which can give rise to a lot of stress. So, what are the problems that one can face during the early pregnancy? Bleeding and pain are the two important things that can happen. You need to be concerned about both of them. And why? I'll explain further. So, if there is bleeding in pregnancy, what are the suspicions that may happen? First things, miscarriage could be a problem. It could be called as a threatened miscarriage or a missed miscarriage or a complete miscarriage. Those are the three things that may happen. Pain could be a part of the same issue of miscarriage, or there can be ectopic pregnancy. So these are the things you should be concerned about. So please approach your health professional if you experience any of these symptoms. Let's talk a little bit further about bleeding in early pregnancy. I'm sure many of you who are pregnant have faced these situations either past or currently facing. And sometimes you feel lonely and without any support. So I feel for all of you, and I hope this will help you with your ongoing management of the current situation or understand what has happened in the past. So bleeding in pregnancy, generally during early pregnancy, once it is confirmed and there are no other medical issues, we don't expect any bleeding during pregnancy. Sometimes if you've had a hard day at work or at home, then there can be some spotting or bleeding. So please follow your general principles of work ethics and at home as well. Don't exert too much during early pregnancy, which may sometimes result in spotting or bleeding. So physical exertion can be one cause. Second thing, local infections. So infections of the cervix may result in bleeding. So definitely if there is a bleeding in pregnancy, please go and see your healthcare professional so they can do appropriate investigation to exclude local infections. Third thing, if the pregnancy is not implanted in the right place, and how do we figure that out? With an ultrasound. So generally if you see the healthcare professional, they will organize for some bloods which would include your beta HCG levels to see where you are in terms of the pregnancy weeks, and the ultrasound will be organized to figure out that the pregnancy is being implanted in the right position. So the ultrasound is normally organized between 6 to 8 weeks to confirm the dates and where it is located within the womb cavity or outside the womb cavity, and also to make sure that there's only one baby inside the womb. Yes, having more than one is exciting, but it also can come with complications. So let's just stick to one baby within the womb cavity. Now, once the fetal heart is confirmed or the baby's heartbeat is visualized, the chances of losing the pregnancy comes down significantly. Again, as mentioned before, generally it would still be okay in the early parts of pregnancy provided everything else is going okay and an ultrasound confirms that there is a fetal heart. We expect that the pregnancy will progress normally. Occasionally, you may find that there is either no fetal heart or there is no heartbeat to the baby, or there is no growth in the size of the baby, without any fetal heart. That means there has been a miscarriage. In a situation like this, what do you do? Yes, obviously you will panic, but also it is important to make rational decisions where you go for care. You don't want to go to the emergency, wait there for 4 to 6 hours and get told you just have to go home. So please listen carefully if this is something that you're experiencing or you have experienced in the past. The options in terms of management. First things, remember these are sterile products. So you have the option of waiting for up to 10 days to wait for spontaneous expulsion of the products. Or you can seek help from your healthcare professional who can refer you to your local early pregnancy care clinics where they can offer you surgical management. If you start bleeding while you're waiting to see your own healthcare professional, then you may want to observe for the quantity of blood loss. If it is getting too much, please seek help from your healthcare professional or local emergency. Otherwise, you can wait for it to subside by itself, but definitely have an ultrasound done after the complete cessation of bleeding to make sure there is no products left behind in the womb cavity, which is very important. So please take advice from your healthcare professional. This is only a general guidance. I would like to reiterate that if these are symptoms that you're experiencing at the moment, please visit your own healthcare professionals. If it is too bad, to the emergency department, or if you would like to see us for any other purpose, please visit athenawomensclinic.com.au. Thank you.